Hi, this is Dr. Anilak at thegentlendentist.com. We're in Shelby Township, Michigan. And right now, today, we're going to be delivering for Frank what's called it's a sleep apnea appliance, and it's used to bring the lower jaw forward. And Frank's been a patient of this for a while, and we had noticed at one point in time when we were doing some sedation on him that he was stopped his breathing, so he had apnea. So finally, you had a test, right?
Yeah.
A sleep study done.
Finally, yeah.
And you've been having some difficulties in sleeping, right?
Absolutely, yeah.
Okay, tell us a little bit of the symptoms that you're having with that.
Oh, just can't sleep on my back. I was snoring on my back, and then when I sleep on my side, I was just getting kinks and stuff. And I just went through my test because after I had my problem with my leg,
right,
I had to sleep on my back, and I realized I couldn't, so I realized I needed to check this out.
Yeah, and you were not getting restful sleep.
Not
By the
at
time
all.
you had a sleep study done, and you had pretty poor performance with that.
Absolutely.
So what we're going to do is, he chose, rather than using a CPAP machine, which is a mask that goes over your face, that we're going to be using this oral appliance here. And what it will basically do is, if this is for the upper jaw and the lower jaw, it's going to it's going to keep this moving his jaw forward, and we can actually adjust that. So we're going to just do it by some trial and error for right now. So we went ahead and placed it in. So what we end up doing is when you put it in, this is called the SWAT appliance, and what it does is it has on it, it's kind of unique, and then it has a little plunger here, and that keeps it in this, we can adjust it for how much the lower jaw is going to be pushed out. These elastics can be changed by the patient, so it allows for more freedom of movement. So what we do is we just put it in hot water for just a few seconds. This is what our patients will do, put it in hot water, and then Frank's going to go ahead and we'll help Frank put it in. It's going to take a little bit of time to get used to it. Yeah, so, but, okay, go ahead and bite down right into that. There you go. Okay. And so that's kind of what it looks like in the mouth, and it still gives Frank freedom to move. It looks kind of
I can talk.
funky.
I can talk normal. That's pretty good. I did try something over the counter. It's called a Snore bender or Snore bender, and I wasn't satisfied with it. I can see that this is going to be much more fit. You know, it's going to be much more functional, and I think it'd be much more
Functional. Be able to sleep with it.
And be able to sleep with it.
And that's the thing, is like with the CPAP machine, unfortunately, it's hard for people to get used to having something like that. And for mild to moderate sleep apnea, this works out very well for patients. And you know, the nice thing is it's portable too. So if you go somewhere, you don't have to take this big machine along with you.
That's true. Yeah,
and then,
I never thought about that.
You know, this is very durable too, because it's got the metal on the inside of it. It's much more reinforced.
Absolutely.
So what we're going to do is we're going to see Frank back in about a week or so, and we're going to see how he's doing. He's going to record to see how he's doing with his sleeping, and if we need to move that back a little more so his jaw comes a little bit more forward, we'll go ahead and do that. So but we'll see what it's like next time, and that'll definitely help you to get a better night's rest. So
good.
Thank you. If you have any other questions about that, our website is thegentlendentist.com. And you can call us also if you're in the Michigan area, and our phone number is 586-247-3500. Thank you. So today, after about a week or so of Frank using the SWAT appliance, we ended up putting a couple more of these little devices in here, which are going to move the jaw forward a little bit more. And he's been doing some exercises in the morning, so that when he actually will be able to move his jaw back, because when you move your jaw forward, you have to spend some time to move the jaw back physically to help with the bite, making sure the bite stays. Now, Frank, you're reporting that you're actually able to get a good 8 hours sleep, right?
Yes, I have. Yep.
And so, how's this been comfort-wise? And
Absolutely. The device is fantastic. It is comfortable. I have no problem with it during the night. It's a dream. I really appreciate it.
Okay.
It's very helpful.
Well, you've been able to sleep longer periods of time.
Absolutely.
And feel a bit more rested too.
Yeah, absolutely.
And I think as we continue to move the jaw forward a bit more, we're going to find you're having less of these episodes of stopping the breathing and having a deeper sleep too. So if that's of interest to you, if you or a loved one of yours is having an issue with sleeping, and especially with obstructive sleep apnea where you stop breathing at nighttime, you can give us a call and we'll work with your sleep doctor in a best way to, if you don't want to wear the CPAP, the mask that fits over your head, and use something like this is convenient for yourself. And this is actually really good for truck drivers and for even people in the military too, who don't have the ability sometimes to go where there's electricity available for the CPAP machine. So if you have a question about that, feel free to call us at 586-247-3500 or visit our website at thegentledentist.com. Thank you. Have a great day.